My name is Victor, aka Victoria Porkchop Parker. I am a female impersonator and entertainer, and my nose looks like chopped pork. I was born in Anderson, South Carolina, and I grew up in a very conservative home. I basically had to stay home unless I went out with my parents. They were overprotective, probably to the max. I wasn't allowed to have friends over. I wasn't allowed to sleep at anyone else's home. I wasn't allowed to visit anyone else's home because I was gay, and I was never one who could hide it. I've never been asked, was I straight? I had family members who competed for the title of Miss North Carolina from the time I was a very little child, and I'd stay up late at night doing nothing but watching pageants on TV. Somehow I knew that one day that I could do that and I was gonna be able to express myself in that manner. And I basically taught myself how to walk, how to talk, how to perform, how to be a pageant performer, and I've been an overachiever all my life. Winning one national pageant was enough. I had to win 7. I first started having silicone treatments in 1999 after I started to see lines and things that I needed to have fixed. And the person who was doing my silicone work was actually a nurse at a plastic surgeon's office. She had a setup in her basement, kind of like what you would see in a doctor's office, so I trusted what she was doing. I had silicone injected into the tip of my nose, into the bridge of my nose. Over time, all of that started to shift. And I started seeing nodules in my face, granulomas, and eventually it became very noticeable, not only to me, but the public as well. People laughed at me. I immediately started pursuing trying to get my face back in order. I was referred to a plastic surgeon, and I was given a rhinoplasty, and I had 6 silicone granulomas removed from my face. About a week later, I noticed that there was a little bump here that was not there before, so I feel like I've got a wart on my face. When I'm dressed as Victor, I'm a very vulnerable person. I would say the last time I was able to go out in public as Victor and feel good about myself was in 1994. I would love to be able to walk out the door as Victor without hiding behind a mask of makeup or sunglasses or a hat, but my makeup is my mask, because if someone laughs at me or attacks me dressed as this, I can freely attack them back because I have the strength to do so. I need this surgery for personal reasons. I'm almost at the end of my career as Victoria, and I'm going to be facing life as Victor very soon, and I want to have the rest of my life as a confident, comfortable individual.
Let me tell you about our next patient. A patient named Victor, or other times Victoria. So Victor has had silicone injected in his face. Subsequent to that, Victor had rhinoplasty where they try to excise granulomas in his nose.
This is getting worse.
I think the best thing to do, obviously, is just have Victor come in.
Yeah.
Can you please send Victor in?
Well,
Victoria,
hello!
how are you?
I am wonderful. I'm Porkchop. Please call me Porkchop.
I never called anyone Porkchop before. That's a new one to me. How do they pick a name Porkchop for you?
My mentor, they used to love to come to my house, and every time they would come, they wanted me to fry pork chops. So I would fry them pork chops.
Okay.
And it so happened that that night, they were the person who introduced me on stage. So they said, "Welcome to the stage, Victoria Porkchop Parker."
Okay.
And I was like,
So can you take us back to the beginning and tell us about the plastic surgery you've had?
well, certainly. I started having silicone injections done in 1999, and there was a nurse at an actual plastic surgeon's office. She had a basement set up, pretty much like a doctor's office.
The plastic surgeon didn't know about this, of course.
Obviously not. Until about 2009, went to a plastic surgeon. I had a nose reconstruction. Because of what he did, it shifted, and now I have a huge granuloma here that's getting bigger and bigger.
That is scary.
Injecting silicone destroys the underlying tissue by causing a severe inflammatory response called granulomatosis. It becomes a chronic problem. Let's get to the exam room and examine you, but we really need to have you do one thing for us.
Okay.
I know you came in as Victoria. We need to go back to Victor a little bit without the makeup, the forehead, and the nose.
Certainly.
So let's do that.
Whatever you guys need, I'm ready. I'm going to strip down to Victor. They're going to see all my flaws. They're going to see me as I never want anyone to see me. So let's hope that they're able to help me, because I'm showing myself to the world.
Hello.
Hello, doctors. How are you?
So this is what you look like.
This is me.
Take a peek. Why don't you lower your chin just a little bit? So that doctor made an incision across the top of your tip, and also lift your chin up just a little bit, and right here. And you got that lump right there and that huge blood vessel.
Pork chop is a really difficult problem. There's probably a poor amount of blood supply to these areas, and any surgical procedures that are performed are at high risk for wound healing problems, skin loss, and skin death.
You live like a man, so obviously you do not have breast implants.
No.
What about over your ear?
Well, you want me to take this off?
Sure, go ahead.
Here, would you like to hold that? Maybe
Well,
you can
thank
try
you.
it on later.
Yeah.
So let's see here, just right in the hairline, right in here. We probably gonna make a little incision there and get something called temporalis fascia out. Dice it up into small pieces, wrap it up, and put that right here.
Okay.
The good news is when they took the granuloma out of the right side of your nose, it didn't come back. However, whatever silicone was on the left side got activated. So obviously you know that could happen.
Yes, I'm willing to take the chance. I don't think that anything could look worse. At least if I try, then I know I've done it, and I've done with the very best. I would rather die trying than live like this the rest of my life, ashamed of who I am. Thank you so much. Can I give you a hug?
Of course. I don't like going into a nose that has had silicone injected into it because you know what? You can never know what's going to happen. But I'm excited to help Victor. He deserves it.
So this is the back, right?
Yeah.
Oh yeah, we need a selfie.
Oh! you really are.
I'm here to check in with Dr. Nassif.
Okay, perfect. Go ahead and sign in.
Today is my surgery day. I'm hoping to be able to walk the streets very proud as Victor, knowing that I am looking as good as I possibly can, and knowing that I have nothing to be ashamed of.
Let's talk about your nose. We're doing an open rhinoplasty, making a small incision underneath here. Now remember, last time they took out a granuloma on the left. They didn't touch the right, but then later on you develop one on the right. So you getting a granuloma, there's a risk for it. I'm scared, but you know what? You gotta be scared when you're doing these procedures. If you're cavalier with these surgeries, you're not gonna get a good outcome. Then the last complication is what we call tissue death, where the skin of your nose can turn black. We got a hard nose. I'm wondering, what am I gonna find? How's the skin gonna react? And if any of those granulomas are gonna become very reactive and then cause more granulomas. I'll begin Victor's surgery today by removing rib from his chest and fascia from the head to use in the reconstruction. I'll then open up the nose, reconstructing the inside using cartilage from the rib and fascia from the head for structure, camouflage, and length. The goal is to give Victor the nose he's always wanted without activating the granulomas in his face. Do we have an extractor? Let's see if I can do this. Whoa! Whoa! Oh. Victor has a huge blackhead on his nose, and when I take all that junk out of that zit, it's interesting. The whole area just goes. That means Victor did not have a granuloma. He had a giant, enormous zit. No granulomas, just thick tissue. Made the tip a lot better. Okay, that's it.
Hi, Dr.
Victor.
Nassif, how are you?
Let's take a look at your nose.
Okay.
Okay. Houston, we have a problem.
Okay, and I can smell like an odor too. So
Okay.
something
What
tells
does
me.
it smell like? Smell like something not good?
Yeah, it kind of smells like dead skin.
What I didn't want to happen. He has some tissue death, and it's significant. Take a peek.
Yeah, that doesn't look too good.
It doesn't look good.
Seeing my nose in the mirror for the first time, my immediate thought was, oh my God, I've got a flesh-eating bacteria on my nose.
This is a complication. So now what we have to do is go back into the operating room to do a scar revision and bring in the two edges of normal skin together.
I knew about all the problems that could happen going into it. I am worried because this is the worst thing that could have happened. We've come this far, let's keep going. I'm going to do everything you say.
All right, Victor.
Thank you, Dr. Dubrow.
Good job.
Thank you, Dr. Nassif.
Take care.
See you later.
I will see you guys later. Thank you very
you're
much.
welcome.
I'm ready to fight. Hello,
Mr. Victor.
my favorite doctors.
That area that was, well, that necrosed or that dead tissue, it actually got a lot smaller. And it's actually matured a little bit, so now we'll be able to go there, remove the scar tissue and close it. hopefully get a great result for Victor.
What would you say my odds are of this working?
You know what? I don't even want to even guess it right now. Ask me in about 35 minutes. Due to Victor's nasal complication, we're scrubbing back in to excise the dead tissue from the bridge of his nose. Once it's removed, I will suture the edges of his good skin together, removing the divot and giving him a normal nose that he doesn't need to hide with makeup. The reason why the tissue died most likely is because of previous surgery. The dissection could not be on the right plane, could have destroyed some of the blood supply. Hopefully this procedure will work.
I haven't worked at all since I had my surgery. It's going to be great to get back out on stage and show all my friends and my fans what I've been doing the last few months. They get to see my new nose. They get to see the new me. I can't wait to see the look on my friends' faces when they realize Victor is here and Pork Chop's not in the show tonight. They don't really know me as Victor. They know me as Pork Chop. So I'm a little bit nervous if they're going to really like me because I'm not really the persona they see on stage. I'm someone completely different. So now's their chance to really get to know who Victor is. And it feels amazing because I never thought that I would get here.
Hamburger Mary's West Hollywood, how's everyone doing tonight? Well, we have a very special guest for you tonight. She's been off the scene for a while, but she's back tonight just for you. Make some noise and welcome to the stage, Victoria Pork Chop Parker!
I have never been a real confident gentleman. I've always been very confident in drag because that's what I do for a living. All of these ladies here, we all put on this wonderful persona that you all love to see, and we all love to give it to you. What we do to ourselves because of that is we kind of hide who we are underneath the makeup and the female attire. Because of two wonderful physicians, Dr. Nassif and Dr. Dubrow, I'm able to stand before you as a very confident gentleman now. Dr. Nassif gave me back confidence that I haven't had since before I started female impersonation. And most importantly, the ability to look at myself and not feel like I've got to have a different persona about myself. Thank you, baby. Thank you.
Okay, so this happened.
Wow, oh my God.
Yeah. Talk about a happy face. Hello.
I know, look at you on stage. Look at you.
I know, I'm not used to it. Gotta look okay.
Amazing.
Thank you.
Confident.
I feel very confident. Usually to get ready, it takes Pork Chop at least 2 hours. Tonight, it only took me 20 minutes. I can't beat this. So, hey, you're going to be seeing a lot more Victor. Trust me.
You know, the confidence exudes, even like from now till that, you radiate.
Oh, thank you so much. Before my surgeries, my nose looked like chopped pork. And I hated my appearance. I always hid behind Victoria. I always wore makeup and wigs, even when I didn't have to. But now, after the surgeries, my nose is smooth as a slice of ham. And I'm finally comfortable in my own skin as Victor. I've been out of the picture forever, it seems like.
And do you like being back now? Is this?
Yeah, I'm ready to see what's going to happen.
Okay.
I'm ready to set myself in motion and work the rest of the year. This whole experience has changed me, and it's made me realize that I haven't got to be anybody but who I am, and I can accomplish anything I want to accomplish. Ladies, thank y'all so much for coming, but here's Nikki.
Ooh, let me get my quarters out, girl.
Yeah.